Hello, everyone. Welcome to this week's COVID-19 update. I'm James Milan, and I am with the town's Director of Health and Human Services, Christine Bongiorno. Christine, I understand you've got a real busy day, even by your standards, so we will cruise right through what we're doing here. We want to talk about the vaccination situation specifically in Arlington. But first, I'd like just for you to run through the numbers with us and give us your observations what those numbers indicate for Arlington right now.
Sure. So to date, we're over 1,700 cases here in Arlington since last March. We did see obviously a spike around the end of the year, beginning of the year, which was the same spike that we saw across the country, across the state. We've been seeing a little dip, but we're starting to see the numbers bump up just a bit. I don't want to say that we're in the middle of another spike, but we are definitely not seeing the cases go away completely, which, really is cause for us to continue to remind residents to stay vigilant. It is incredibly important that, although we have the vaccine available, not everybody has been vaccinated. In fact, there's a huge population in our community that can't get a vaccine because they're not of age, and won't receive one until the FDA approves vaccine for children. So just making sure that residents continue to remain vigilant. It feels like we're ready for to be done with COVID. But unfortunately, it's still here, and it is something that we still remind residents to remain careful and protect themselves. We've had so far in Arlington 85 deaths since the beginning of March. We've had a few, surprisingly, even though a lot of our over 75 have been vaccinated, we're still seeing some deaths in some unvaccinated individuals. But that has slowed down quite a bit as a result of the vaccines, which has been very rewarding for us and very, important for our community.
Yeah, I did want to just kind of cite a couple of things in what you just mentioned, and one is, usually I'm talking to Adam at this time, Adam Chapdelaine, our town manager, and he and I have often discussed the fact that the news has been good for a while in our 70 and up population in terms of the numbers. For a good long while now, a couple of months, in terms of just really tiny incremental growth in cases. But as you say, there are deaths of unvaccinated individuals. Didn't know that. Again, it's that theme of yours: stay vigilant, including again in all sectors of the population. But also, I want to extend. I'm not sure if it's congratulations, but I do want to recognize that the work of your department, as well as a lot of the facilities in town, has kept or ensured vaccination for our older population and has kept those numbers lower than they might otherwise have been. So that's definitely good news. And then the other thing is, I'm glad that you mentioned that it's not another spike necessarily, as you said, but nonetheless, the numbers are not just continuing to move in the direction that we want inexorably. So hopefully that in itself is a good reminder to people to just continue to observe the proper protocols, et cetera, as we are all very, very familiar with at this point. Another thing, Christine, I wanted to ask you about is somewhat of a theme of my conversations with both you and Adam over the last month and a half or so, concerns the state's approach to vaccination, and the fact that their choice to kind of work through mass vaccination sites, et cetera, has meant that there's, local boards of health like ours that you run, ready to do more than you've been able to do. Nonetheless, I know that vaccination has continued to carry on here in Arlington for specific populations. Can you give us an update around that?
Sure. So, as you know, we've partnered with Belmont and Lexington to kick off our vaccines beginning in January. So to date, we've done almost 5,000 shots in arms, which is pretty remarkable given the fact that the state did cut our allotment and limited us for a number of weeks to only 100 per week per community. So we were able to leverage and access vaccines for various populations. So the state did allow us to vaccinate our homebound or is allowing us to vaccinate our homebound residents as well as our residents in senior housing. We've really, being able to provide vaccine to those populations because we know we see the cases in those areas. That's where, specifically the homebound population, they were sort of being cared for by family members and caregivers that would bring COVID into the home, and then we would see a positive and some, in some cases even death as a result of, not being able to be more independent. So we're really excited to be able to get out and vaccinate those individuals to protect them. We also were able to, we will soon be going back and doing our second doses of the residents in the senior housing facilities. So the Arlington Housing Authority buildings. It's been great working with that population. Again, those are people that they're living together. They're basically in congregate facilities with common areas, laundry areas. So if a case is in those facilities, we'll often see additional cases pop up. So it's for our department really important for us to be in those places. Our social workers and our council on aging work with a lot of those residents, so they know the needs and they know the issues that that those residents face. So we went door to door in each of those buildings, and we will go back, like I said, for the second doses to go door to door and to be able to provide that service to those residents in need. So it's been incredibly rewarding. In addition to those vaccination programs, we were able to leverage some additional vaccine to really find our most at-risk population. So we did a lot of the 75 and over, and then the 65 and over population. And although we didn't have enough to cover everyone in those areas, we worked with our council on aging, our veteran services, and our other service providers to really find the residents we knew that didn't have access to the internet or have younger family members that were refreshing the screen to access appointments at Fenway or Gillette. I think what we find is that we have a great network of staff here in our department as well as in the community that really can help us identify those individuals. And we feel like we were able to get as much vaccine as we could in order to address that. And there's still, unfortunately, there's still so many residents out there that need it and can't access appointments. But we know that the vaccine is soon, there will soon be too much of it and not enough people to vaccinate. So I think what our message has been, I know, I can't wait for that moment. And it's coming, it's very soon. I do see it. I do see this sort of opening up for people. I think we just tell people to be patient because it is coming. The demand is usually in these situations just so high at the beginning. We've seen this throughout the course of so many different years with flu vaccines. So if there's a shortage of flu, there just seems to be this rush and this huge demand, and people get very frustrated and upset with the systems. But it eventually becomes, there's this turning point where it just becomes there's just too much vaccine and not enough.
Sorry, but it does remind me. It seems like such a deep human impulse because whether it's vaccines or whether it's toilet paper at the grocery store, I remember back last spring when the shelves were completely empty. Not really because everybody was running out of toilet paper, just because people needed to get just that fever. 5,000 shots in arms. That is a great thing to share, I think, with our audience because it's a surprising number, possibly to you, to me, and maybe to many in the audience, given the numbers that you and I have been talking about over these last months, and the fact that you were restricted for a while to 100 doses per week, et cetera. That's quite an achievement. So congratulations on that. And lastly, I'm glad you mentioned that you are dealing specifically with the homebound population because, of course, I think I've mentioned to you before, have an octogenarian, my mom living with us in the house. We're her primary caregivers, et cetera. She is in that position. She has now completed her course and even the 2 weeks after her second shot. So we are all breathing much easier here even if we haven't gotten our own because of our concern for her. So I'm sure that is replicated in so many households that you alluded to,
Mhm,
from the
mhm.
fact that you guys have been in there and taking care of the older residents. That's great.
Yeah. Well, I will say, just to clarify, the homebound vaccination program will start in the beginning of April. So we haven't necessarily gotten out to do those residents just yet. We have our lists. We're starting to access, the state vaccine, and hopefully we're hoping that we get the one shot, we get the Johnson & Johnson vaccine for this project, so that we can do more, with fewer resources. So.
Yeah, I think it's at this point, it's kind of a little bit like you said. I think people, and it's wonderful to hear your confirmation as the person who knows the most, that a wave of or I don't know what a flood of vaccines are coming in, or you anticipate that, and soon there will be more than enough. Because right now, I think a lot of us are hoping that we're going to get the J&J so that we, again, just it expedites everything.
Yes,
So keep
exactly. Yeah.
fingers crossed. Thanks for that clarification. Those, households are going to be feeling the kind of relief that I was just talking about.
Yeah.
So. All right. I have been speaking with Christine Bongiorno, who is the Director of Health and Human Services here in Arlington, and our, for want of a better term, our COVID-19 czar and guru, Zarina and guru here. Thank you again for your time and for your efforts. And we look forward to the next time we speak to you, which will probably be in about a month or so. And we expect, I think all of us, and hope that we'll be smiling at that point.
Yeah.
All right. Good luck. Thank you very much. I'm James Milan. This has been this week's COVID-19 update. Thanks for joining us. We'll see you next time.